Good morning everyone, I'm Dr. Vishista. So today we'll cover the topic about adult orthodontics. So what is an adulthood? What age can be considered as adulthood? So in females and males around 16 and 18 and 19 can be considered as adulthood, though there is no definite age. Two kinds of adult patients are seen. So one are those who do not avail treatment as a child. Okay, so young adults who wanted to attain treatment as a child but could not attain and they are interested now, and those with prosthetic or restorative requirements, that is the older patients who have certain requirements, other specialty requirements, like to have to get their crowns replaced or procedures like that to be done. For them we have to correct the adjacent teeth and all to proceed with those treatment. So two kinds of patients. For the first group, the goal is only to improve their quality of life. So they usually seek comprehensive treatment and maximum improvement, whatever that is possible. They just want the proper function and aesthetic improvement. Okay, they may or may not need any coordinated treatment with other dental specialities like prosto, endo, surgery and all. They just want their aesthetic and functional improvement. The second group, they seek to maintain what they have. So they don't necessarily require ideal result as such. Whatever ideal result that is possible for their teeth, but they seek that much treatment. For them, orthodontic treatment is mainly needed to meet the specific goals that would control the disease or restorative or missing teeth, whatever are the problems. Whatever procedures that are need to control those existing diseases is what they need for the treatment. So they just want their treatment to be easier and effective. So orthodontics is just an adjunctive procedure to a larger periodontal or restorative goals for these patients. So adult orthodontics is mainly concerned with the balance between optimal proximal and occlusal contact of the teeth, the acceptable aesthetics for an adult patient, the normal function for them to eat, chew, for the speech and all, and a reasonable stability that is required according to Ackerman. So the additional orthodontic treatment objectives will be the parallelism of the abutment teeth. That is, if a patient wants a tooth that is missing to be replaced, the adjacent teeth parallelism is very important. So we have to upright the adjacent teeth so that the pontic space is maintained and easy replacement of the teeth can be seen. Most favorable distribution of teeth is important. Redistribution of occlusal and incisal forces, adequate embrasure space and proper tooth positioning, all the teeth in proper positioning, acceptable occlusal plane and a potential for incisal guidance at a satisfactory vertical dimension. So this picture we can see that the adjacent, the edentulous space is the space where a tooth is to be replaced. So the adjacent teeth, they are not parallel. In the second picture you can see the adjacent teeth are properly parallelism is maintained so that the pontic can be placed. So other additional orthodontic procedures would be adequate occlusal landmark relationships, better lip competency and support, improved crown root ratio, improvement or self-correction of mucogingival and osseous defects, improved self-maintenance of periodontal health. This is like one of the most important thing, aesthetic and functional improvement. So reasons for increase in adult patients. Why? So when compared to like last decade or so, the adult patients going to an orthodontic treatment, acquiring orthodontic treatment has increased. So why? Social media. Social media is nothing but the public awareness. Because of social media, because of the media, all kinds of media, print and media is increased. So patient knows that he can get his dental problems corrected with certain procedures. So that awareness is increased. So the adult patients obtaining treatment has also increased. Insurance. So the third party paying for the treatments has also increased. compared to the previous decade. So that is also helping for the patient to accept more dental treatment. The affluence, the awareness, the patient, the public has more awareness about whatever treatments can be done. And aesthetics. Nowadays, the aesthetics is a prime concern in most of the adult patients, because everybody wants to look better than what they look right now. So for that reasons, aesthetics is one of the most primary concerns in the patient. So and some more other considerations would be innovation and improvement in appliances. So now the in orthodontic appliances, there are many appliances which are clear. So the patient aesthetics, it is not very visible. They have clear appliances, they have aligners which are like sheets. So it is more acceptable to the patient. Increased experience with the adult orthodontics, increased interest in treating dental mutilation problems with tooth movement and fixed processes than removal processes. That is, it is a multidisciplinary approach. So the patient wants to fix the missing teeth and all with the fixed processes like implants, like FPD. So for that, they're getting these treatments done. Effective management of TMD and skeletal dysplasias. So what are the primary differences between an adult and a child patient? So growth potential. The primary difference would be the child would have a growth potential. So when you are doing a treatment in a child, so you can also do a growth modulation along with the fixed therapy. But in an adult patient, the main thing is there is no growth modulation that can be possible. So that is a primary consideration you have to see. Then appearance. In an adult patient is more concerned about the appearance. Whatever appliance like a ceramic bracket or an aligner, the adult patient is more accepting towards those appliances than a metal bracket. Appliance tolerance. A child is more tolerant, and in an adult patient the tolerance levels are little less compared to the child. Speech, the acceptance is more in a child. The periodontal disease is one of the most primary concerns in an adult patient. So in a child, they may or may not exist. Periodontal disease are very minor, but in an adult patient, the chances of periodontal disease are high. So it is very important to consider a multidisciplinary approach, treat those periodontal diseases before we go for the treatment. General health, cooperation, and treatment appreciation. So the cooperation is more in an adult patient because they're more, they are the ones who are more interested. So what are the indications of to improve the teeth periodontal status relationship, improve plane of occlusion and coordination with the TMJ and all the other facial muscles, balance space between the teeth before replacement, improve normal tooth contacts and aesthetics. So what are the contraindications of adult orthodontics is if the patient has severe skeletal dysplasias, then we can't go for, so it is contraindicated. So advanced local or systemic diseases, excessive alveolar bone loss, inability to obtain a result that is perceived satisfactory, poor stability or prognosis, and lack of patient motivation. These are the contraindications for the adult orthodontics. So what are the biomechanical considerations? Before we treat an adult patient, we have to see the age changes in periodontal ligaments. So what happens is as the patient age increases, there is this decreased vascularity and blood flow of the patient and that would also have progenital cell decrease. So that will lead to decreased reaction to the orthodontic forces. Age changes in bone. In bone, the two kinds of bone, the cortical and spongy bone. So the cortical bone gets more dense and the spongy bone, it decreases. So what will that lead to? The remodeling and resorption is affected. So what are the local changes that will happen? The marginal bone loss, or that is age and periodontal disease what will happen when there is marginal bone loss? The center of resistance that is there will go a little apical. That will lead to loss of teeth or atrophy of supporting bone or displaced teeth that will lead to occlusal function that is affected. So as in this diagram, pointer is not, 1 second. Just calling some. I can continue. So as you see in this picture, in the first picture, the center of resistance, you can observe it is in the center, and in the second picture there is a marginal bone loss or periodontal loss. That what happened is the center of resistance shifted more apically. So what are the treatment considerations that are to be seen? The standard approach for both adult and child patient is same. Okay, but the other considerations that are to be seen is the conservative and controlled treatment is to be done in an adult patient. Light forces is very important, that light forces are to be given. Movement to force ratio is increased, and other patient requirements like appliance, treatment time, cost and inconvenience are to be considered properly. So the diagnosis and treatment planning, local and systemic evaluation in an adult patient is very important. All systemic evaluation is to be done. The general health status of the patient is to be considered properly before we start the case. Condition of the dentition, that is tooth wear that is seen in the patient, that is to be considered. Any restorations or any processes that is required is to be considered using a multidisciplinary approach with other departments. Parafunctional habits, if they are present, are to be corrected using various appliances. Additional diagnostic procedures, whatever are required, are to be taken, and multidisciplinary approach is very important. So what are the treatment aspects? That is adjunctive treatment, comprehensive treatment and surgical treatment. So what is an adjunctive treatment is, it is by definition, it is a tooth movement that is carried out to facilitate other procedures, other dental procedures like crown placements or anything to restore, or that is necessary to control a disease or restore function. So adjunctive treatment will involve any or all of the following procedures, such as repositioning the teeth that have drifted after an extraction or bone loss. Okay, forced eruption of badly broken teeth, so as to expose a proper sound root structure to which crowns can be placed later on. Alignment of anterior teeth to allow more aesthetic restorations, or successful splinting while maintaining good interproximal bone contour and embrasure form. Correction of cross bites if these cross bites are compromising any jaw function. So in this picture you can see the molar in the picture is tipped. So a distal crown movement is given and the molar is uprighted properly so that a pontic can be placed for increased pontic space. So that was adjunctive treatment. The comprehensive treatment includes, there is no fundamental difference between, in a comprehensive treatment, there is no fundamental difference between adults and children. The response may be somewhat slower in adult patient because of different factors, but the comprehensive treatment can be, for an adult, can be divided into some stages. Special aspects for orthodontic appliance therapy for adults include, the goals and stages are same for adults as those of adolescents. However, the mechanotherapy has to be modified. Mechanotherapy is nothing but if the patient has lost some periodontal support, it is especially important to keep the forces very, very light. The biological response is determined by the pressure on the PDL, pressure in the PDL and not the force against the tooth. So the force that is given to an adult patient is to be reduced considerably. Space closure may be contraindicated if the teeth have lost due to periodontal diseases. Important planning criteria is the extent to which a jaw discrepancy can be camouflaged successfully without any surgical correction. That criteria is to be considered before treating. Then there is combined surgical and orthodontic treatment. For patients whose orthodontic problems are very severe, that वैसे the adult patients growth modulation can't be done. So in a skeletal, when the skeletal discrepancy is very severe, camouflaging can also may also not help. So in that cases, surgical realignment of the jaws or repositioning of the jaws can be done. So surgery is not a substitute for orthodontics, but it can be done as an adjunctive procedure, as like both surgical and orthodontic procedures can be done. It must be properly coordinated with the orthodontics and other departments to get a good overall result. So what about retention? So in adult patients, it is very important to have good retention. So a long-term retention is mandatory. Stabilized with immediately placed retainers, that is immediately after the treatment, a retainer or a splint is to be placed in the patient's mouth to have a proper occlusal relationship. And other short-term possibilities for retention are occlusal splint, providing a positive indexing of the teeth, which can extend buccally and lingually to maintain tooth position, or any appliances like wraparound retainers or S6 retainers can be given. Long-term splinting usually involves cast restorations. So coming to conclusion, a typical adolescent patient's passive acceptance of Coming to conclusion, the typical adolescent patients have more passive acceptance of what is being done, and that is rarely seen in an adult patient. So an adult patient requires more degree of explanation and more explanation about what is going on, what is going to happen, and why are we doing a certain procedure. In adult, in addition, in an adult, as a rule, they are less tolerant to the discomfort, and they are more likely to complain about the pain after adjustments, about difficulties in speech, eating, about tissue adaptation, etc. So all these considerations are to be considered properly, and an adult treatment can be done smoothly then.